Good evening. This is All India Radio. I'm Sunil Verma and with me is Aditi Lumba with the evening news. The headlines. Prime Minister Narendra Modi to address India Idea Summit organized by US-India Business Council at 9 tonight. Defence Minister Rajnath Singh lauds IF's role in challenging circumstances, asks IF to stand ready to handle any eventuality. Highest ever number of COVID-19 recoveries recorded in the last 24 hours. 28,472 people discharged across the country. 14 days complete statewide lockdown announced in Manipur from tomorrow. Rajya Sabha Chairman M. Venkaiah Naidu urges newly elected members of the House to uphold rules and procedures. Relief and rescue operations in full swing in flood-affected areas of Assam and Bihar. Prime Minister Narendra Modi will deliver the keynote address at the India Idea Summit at 9 p.m. today. In a tweet, the Prime Minister said he is looking forward to share his views on building a better future, which is the theme for this year's India Idea Summit. The two-day summit, which began yesterday, is being hosted by the US-India Business Council. This year marks the 45th anniversary of the formation of the Council. More from our correspondent.
Prime Minister Narendra Modi will provide perspective on how US-India partnership can shape the post-COVID world. The virtual summit will witness discussions on areas including India-US cooperation and future of the relation between the two countries in a post-pandemic world. It will feature high-level presence from Indian and US government policymakers, state-level officials, and thought leaders from business and society. Key speakers at the summit include External Affairs Minister Dr. S. Jaishankar, US Secretary of State Mike Pompeo, Senator of Virginia and co-chair of Senate India Caucus Mark Warner, former US Ambassador to the United Nations Nikki Haley, among others. With Anand Chaturvedi, Suparna Saikia, AIR News, Delhi.
External Affairs Minister Dr. S. Jaishankar today said the US has to learn to work in a more multipolar world with more plurilateral relationships and go beyond the alliances of the last two generations. Addressing the India Idea Summit, he said, India and the US have the ability to shape the world by working together.
We have the ability today, by working together, to shape the world. We are working on maritime security, counter-terrorism, connectivity, how to respond in the case of corona to pandemics, even issues like climate change, the knowledge economies. A large part of it is how do we, strengthening our bilateral agenda, shape a larger agenda.
The minister said there is a need to think bigger, even as India and the US work through trade issues. He also said the two countries need to resolve pending problems. Prime Minister Narendra Modi has congratulated nuclear scientists for achieving criticality of Kakrapar Atomic Power Plant KAPP-3 in Gujarat. In a tweet, Mr. Modi said this indigenously designed 700 megawatt electrical KAPP-3 reactor is a shining example of Make in India. He said this is a trailblazer for many such future achievements.
Defence Minister Rajnath Singh has appreciated the proactive response by the Indian Air Force in bolstering its operational capabilities over the past few months. He stated that the professional manner in which Indian Air Force conducted the airstrikes in Balakot as well as rapid deployment of assets at forward locations in response to the prevailing situation in eastern Ladakh has sent a strong message to the adversaries. Mr. Singh was speaking after inaugurating the 3-day Air Force Commanders Conference in New Delhi today. He alluded to the ongoing efforts for de-escalation on LAC and urged the Indian Air Force to stand ready to handle any eventuality. The Defence Minister praised the stellar contribution by Indian Air Force in supporting the nation's response to COVID-19 pandemic. He highlighted the need to achieve self-reliance in defence production. Mr. Singh lauded the progress made towards enhancing synergy and integration within the three services since the appointment of Chief of Defence Staff. Speaking on the occasion, Chief of the Air Staff, Air Chief Marshal RKS Bhaduria stated that the Air Force was well prepared to counter short-term as well as strategic threats. He said the units were evenly poised to counter any aggressive action by the adversary. A correspondent reports that during the 3-day conference, commanders will review the current operational scenario and deployments before deliberating on building the Indian Air Force capabilities in the next decade to tackle all emerging threats. The government today said that the country has registered the highest number of COVID-19 recoveries in a single day, with 28,472 people cured of the disease. Union Health Ministry said this is also the highest number of COVID patients cured and discharged in last 24 hours. A total of 7,53,049 people affected with coronavirus have recovered in the country so far. With this, the recovery rate has reached 63.13%. The ministry said the constantly increasing number of recovered patients has further widened the difference, with active cases to over 3,41,000. The recovery rate in 19 states and union territories is higher than the national average. The top 5 states and union territories are Delhi, Ladakh, Telangana, Haryana and Andaman and Nicobar Islands. The consistently increasing number of recovered persons is a testimony to the fact that the strategies adopted by the centre and implemented by the governments of states and union territories are bearing desired outcomes. The primary focus has been on early detection through house-to-house surveys, surveillance, contact tracing, effective containment plans, screening of the vulnerable populace and widespread testing. The ministry said the ramped-up 3-tier health infrastructure and well-executed standard of care protocol have aided in effective treatment in the hospitals and through home isolation. AIIMS, New Delhi, along with the centres of excellence in the states and union territories, have bolstered the clinical treatment and critical care of ICU patients, thereby managing to reduce the case fatality rate in India. The eICU program of AIIMS, New Delhi, is one more avenue of centre-state cooperation which is aimed at reducing mortality. Conducted twice a week, these teleconsultation sessions have mentored and supported big COVID-19 hospitals in the states through shared experiences and technical advice from experts in the domain of clinical management of ICU patients. With the dedicated efforts of healthcare workers, the number of recoveries are increasing and case fatality, which currently stands at 2.41%, is continuously falling.
All India Institute of Medical Sciences, Delhi, today held the first interactive session of National Clinical Grand Rounds led by AIIMS Director Dr. Randeep Guleria. The session was aimed at facilitating discussion on issues related to COVID-19. Doctors from medical colleges and senior physicians from hospitals located across the country and abroad participated in the online session. Speaking on the occasion, Dr. Guleria said the objective of National Clinical Grand Rounds is to bring down the mortality rate in COVID-19 patients to less than 1%. He said that COVID-19 is a national crisis and that there was a need for a common platform for clinical issues and case-based learning.
We need to have some sort of academic activity at a national level to really apprise doctors at all hospitals which are managing COVID, whether government, private, whether at a district level or at a state level or a tertiary hospital. And the aim was to bring down mortality. Ultimately, what will really matter as far as COVID-19 is concerned is the number of deaths, not the number of cases. And our aim is that we should bring our mortality down to less than 1%.
The first CGR session today focused on managing patients with severe acute respiratory infection who are clinically suspected to have COVID-19 but test negative in the initial RT-PCR. AIIMS has been extensively involved in managing patients, developing guidelines, policies and research in COVID-19. The institute has managed over 4,000 patients of all levels of severity of the disease. In an effort to share its experience and initiate discussions on management of common issues related to COVID-19, AIIMS Delhi, in conjunction with Niti Aayog and Union Health Ministry, has launched the National Clinical Grand Round CGR on COVID-19. The sessions will include presentation of clinical cases by physicians directly involved in COVID management. Challenges faced in patient management will be discussed by a panel of eminent experts from across the country and abroad. Physicians can also ask questions related to patient management during the question and answer session. A total of 1,227 new confirmed cases of coronavirus have been reported in Delhi during the last 24 hours, taking the total number of cases to 1,26,323. The Delhi government has confirmed that over 107,000 people affected with coronavirus have been cured so far. In the last 24 hours, 1,532 people recovered and 29 deaths were reported in the national capital, taking the toll to 3,719. Presently, the total number of active corona cases in the national capital is 14,954.
In our series Expert Speak on All India Radio, we bring you views of leading medical experts on COVID-19. Talking to AIR News, Dr. Ambuj Roy from the Department of Cardiology of AIIMS advises elderly people and those suffering from other diseases like hypertension and cancer to take extra precautions to avoid the infection.
In the larger population, it has given them time to understand the seriousness of the disease, the precautions they need to take, how to live with this. They have practiced social distancing. The people who already have heart disease, people who have had brain strokes, people who have lung disease, people who have some kind of cancer, they're much more prone to a more severe form of the disease if they get the disease.
Dr. Naresh Gupta of LNJP Hospital, Delhi, tells people to maintain hygiene and social distancing.
खांसने के समय ऐसा खांसना छींकना चाहिए कि दूसरे के ऊपर नहीं जाए। टिश्यू पेपर रखे, रुमाल रखे, कोहनी रखे, बचाव करे। एक इसमें और चीज आती है, वो आती है डिस्टेंसिंग का। जब वो खांसता छींकता है तो 1 से 2 मीटर तक वो जा सकती है। अगर आप पहले 1-2 मीटर का फासला बना के रखेंगे तो उसका आपके तक पहुंचने का अंदेशा बहुत कम हो जाता है। जो कॉन्टेक्ट ट्रांसमिशन की बात आई फॉर्माइड से, उसके लिए हम कहते हैं कि आप हाथ साफ करें। हाथ अगर आप धोते रहेंगे तो उसमें जो वायरस है वो साबुन पानी के द्वारा निकलता रहेगा और उसके साथ साथ अगर जरूरत समझे या पानी नहीं हो तो आप सैनिटाइजर का इस्तेमाल भी कर सकते हैं।
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Dr. Aparna Agarwal, Professor of Medicine at Lady Hardinge Medical College, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on a Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:30 p.m. onwards. This program will also be available on our website newsonair.com and our YouTube channel News on AIR Official. You can also follow us on News AIR app for updates. In Himachal Pradesh, the Chief Minister's office has come under the grip of COVID-19. Our correspondent reports that Chief Minister Jairam Thakur has quarantined himself after an official of Chief Minister's office tested positive for the novel coronavirus in Shimla today. More from our correspondent.
Himachal Pradesh Chief Minister Jairam Thakur has self-quarantined after a Deputy Secretary level officer of his office tested positive for COVID-19 today. The staff working at Chief Minister's office has also been directed to confine them in home quarantine. The corona tests are being taken of all those who came in contact with him. The entire office premises of CM and Deputy Secretary is being sanitized. Meanwhile, more than 24 new cases have been reported in the state today. The number of corona-infected cases in the state has now increased to 1,697, out of which 587 cases are active, whereas 1,083 people have been cured after the treatment. Sanjeev Sundaryal, AIR News, Shimla.
You're listening to the evening news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi to address India Idea Summit organized by US-India Business Council at 9 tonight. Defence Minister Rajnath Singh lauds IAF's role in challenging circumstances. Asks IAF to stand ready to handle any eventuality. Highest ever number of COVID-19 recoveries recorded in the last 24 hours. 28,472 people discharged across the country. 14 days complete statewide lockdown announced in Manipur from tomorrow. Rajya Sabha Chairman M. Venkaiah Naidu urges newly elected members of the House to uphold rules and procedures and relief and rescue operations in full swing in flood-affected areas of Assam and Bihar. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
In Manipur, the state government has announced complete statewide lockdown for 14 days from 2 p.m. tomorrow. The move comes after some local persons without travel histories were found positive for COVID-19. The decision to implement total lockdown and curfew was taken during an emergency state cabinet meeting held this evening at Imphal. More from our correspondent.
Briefing the media persons at Imphal, Manipur Chief Minister N. Biren Singh said that the opinion of health experts who are members of State Consultative Committee on COVID-19 were taken into confidence before the decision was taken. Considering the outbreak of COVID-19 mainly in Thawan area where people who do not have travel history were confirmed of positive, the cabinet meeting decided to enforce the lockdown from 2 p.m. tomorrow for 14 days. The case happening in the Thawal district area is suspected to be local transmission. The Chief Minister said the curfew to be implemented from tomorrow will be different from the earlier one. State government will enforce the curfew strictly and fines will be levied who violate the social distancing norms, not wearing masks, spitting in public places and coming out in the public places and mass gathering. This is JJ Thoksom from Imphal for AIR News.
In Madhya Pradesh, the state government has imposed a 10-day lockdown in the capital Bhopal from 25th July following a spike in the number of COVID-19 cases in the last few days. A report.
State Home Minister Narottam Mishra told the media after the meeting of the State Cabinet today that hotels and markets will also remain closed except for essential services during lockdown. As per the State Health Department, all 52 districts have active corona cases. A total of 579 persons were discharged from hospitals today, taking the number of the recovered cases to 16,836. Meanwhile, there will be a ban on entry into the Nag Chandreshwar temple in Ujjain, which opens only on Nag Panchami in a year. According to official information, keeping in view the government's guidelines due to corona pandemic, the district and temple administration has arranged live darshan through website and other modes. Sanjeev Sharma, AIR News, Bhopal.
The West Bengal government has decided to impose a twice-a-week lockdown in the state till August to stem the rise in COVID-19 cases. The state's caseload rose to 47,030 and death toll mounted to 1,182 till Tuesday. The state government has announced that this week's bi-weekly lockdown will be imposed tomorrow and on 25th July. A meeting chaired by Chief Minister Mamata Banerjee arrived at this decision prompted by expert opinion that stressed the need to break the chain of infection.
Rajya Sabha Chairman M. Venkaiah Naidu has urged the newly elected members of the House to uphold rules and procedures of the House while discharging their duties as the lawmakers of the country. He was speaking after the administration of oath or affirmation to the new members of Rajya Sabha in the chamber of the House today. Mr. Naidu urged them to hold themselves to account with regard to their conduct both within and outside the House so as to enhance the standing of the institution in the eyes of the people. The Rajya Sabha chairman urged the newly elected members not to fall prey to the temptation of disrupting the proceedings of the House for short-term gains. He exhorted them to be conscious of their noble responsibility towards enhancing the standing of the apex legislature in the public esteem. He urged the seniors to guide the first-timers in understanding the functioning of the House. Earlier, 45 members took the oath of office in Rajya Sabha chamber while following physical distancing norms. Members including 3 women took oath on affirmation in 10 languages: Telugu, Bodo, Kannada, Manipuri, Marathi, Oriya, Tamil, Bengali, Hindi and English. In total, 61 members including 43 first-timers have been elected to the upper house. The members who could not take oath or affirmation will do so during the ensuing monsoon session. Prime Minister Narendra Modi will lay the foundation stone for Manipur water supply project tomorrow through video conferencing. The Governor, Chief Minister of Manipur and his cabinet colleagues, MPs and MLAs are expected to join the program from Imphal. The centre initiated the Jal Jeevan mission to provide safe and adequate quantity drinking water to every rural household of the country by 2024 with the motto Har Ghar Jal. The mission is based on a community approach to water and has information, education and communication as key components of the mission. It looks to create Jan Andolan for water, thereby making it everyone's priority. There are about 19 crore households in India and only 24% have freshwater household tap connections.
Director General of National Disaster Response Force, NDRF, SN Pradhan has said that the force is working on a mission mode for relief and rescue work in flood-hit areas of Bihar and Assam. Speaking about the flood situation in both the states, Mr. Pradhan said 16 teams of NDRF have been deployed in Assam and 20 teams in Bihar. He said in Bihar the situation was a little alarming yesterday because of the possible influx of almost 5 lakh cusecs of water into the Gandak river and also because of incoming water in other river systems of North Bihar. Mr. Pradhan said in Assam the situation is comparatively better as there has not been as much rain as earlier. The NDRF DG said the relief work is being done facing the dual challenge of COVID-19 spread and floods this time. In Bihar, the flood situation continues to be grim in affected districts. Over 6,50,000 people have been affected by floods in 10 districts, including Sitamarhi, Shuhar, Gopalganj and Muzaffarpur. The worst affected districts are Darbhanga, West Champaran and Supol. 9 people have lost their lives in flood-related incidents. Flood water is engulfing fresh areas following breach of south embankment of Trimeni Canal in West Champaran. Water level of Buri Gandak, Bagmati and Adwara group of rivers is above the danger mark. The Met Department has issued an alert for heavy rains in the next 24 hours in the northern part of the state. In flood-hit Assam, rescue and relief measures are being intensified by the state government. Talking to AIR, Revenue and Disaster Management Minister Jogan Mohan said that rice and pulses have been released today for distribution among the affected people. More from our correspondent.
The Revenue Minister Jogan Mohan said flood water damaged 204 number of embankments and 174 bridges in the state. He said that the State Disaster Management Authority has taken steps to provide online medical counseling to the inmates staying at relief camps. The minister further informed that the 14,000 Pratyodhi Bandhu who are extending support to administration in its fight against COVID-19 and floods would be covered by life insurance. The 14,000 volunteers are instrumental in creating awareness and services during disaster period. About 26 lakh people are submerged under floods in 26 districts in the state. Manas Pratim Sharma, AIR News, Guwahati.
In Meghalaya, over 16 lakh people have been affected due to floods and other natural calamities since April this year. Revenue and Disaster Management Minister Kirman Shaila said so far 5 people have lost their lives in the Garo Hills region due to the recent floods. The government has announced an ex gratia of 4 lakh rupees for the families of the victims. The minister asked the people to remain alert as the water levels may go up again.
The Delhi High Court has asked the centre to consider providing ration to the persons with disabilities, PWDs, based on their disability certificates. The court was hearing the public interest litigation filed by National Federation of the Blind. The court suggested to the central government to initially provide 1 month's ration to PWDs based on their disability certificates, and while doing so, to also get all their details which would be required to issue them a ration card. General Secretary of National Federation of the Blind, Santosh Kumar Rangta, informed the media that the court has directed the Department of Consumer Affairs and Food and Civil Supplies to take instruction by 29th of this month for providing 5% reservation to PWDs under National Food Security Act and Pradhan Mantri Garib Kalyan Anna Yojana. Mr. Rangta termed the order as historic, which will pave the way for 5% reservation in favour of PWDs in all the poverty alleviation schemes. In Chennai, a plasma blood bank has been launched by the state health departments to facilitate convalescent plasma therapy to COVID-19 patients. The State Health Minister, Dr. C. Vijaya Bhaskar, inaugurated it at the Government Rajiv Gandhi General Hospital in the city. It has the facility for 7 people to donate blood plasma at a time. More from a correspondent.
The blood plasma in the new facility in Chennai can be preserved for as long as a year. A person can donate 500 ml blood plasma 14 days after recovery from COVID-19 infection, provided he or she has no other comorbidity condition. Doctors say after a gap of 2 weeks, the donor can offer the blood plasma once more. In Chennai, the convalescent plasma therapy has been experimented in 26 COVID-19 patients and it proved effective in 24. Therefore, the health department is planning to establish more such plasma banks in the Stanley and Omandurar super specialty hospitals in Chennai, the Tamil Nadu Dr. MGR Medical University in the city, and the Government Medical College Hospital at Trichy, Coimbatore, Salem and Tirunelveli in future. Jai Singh, AIR News, Chennai.
In the Union Territory of Jammu and Kashmir, Divisional Commissioner Kashmir chaired a meeting in Srinagar today to review the forthcoming Eid ul-Azha arrangements in Kashmir Valley. He urged the people to follow the necessary guidelines of COVID-19 while celebrating the festival in an effort to prevent the spread of the pandemic. More from our Srinagar correspondent.
In view of the forthcoming Eid al-Azha festival, Divisional Kashmir Panduranke Police said that the markets in Kashmir shall remain open for 3 days from 28th of this month to facilitate hassle-free purchase of sacrificial animals and other necessary items. He directed all Deputy Commissioners of Kashmir to establish sale centers where people can purchase sacrificial animals with proper COVID-19 protocol. He instructed them to open up markets in a phased manner with different timings to avoid gatherings and violation of social distancing protocol by the public thronging marketplaces during these 3 days. He further asked them to notify about operation and timing of mandis and marketplaces in advance for timely information to the general public so that the unnecessary gatherings could be avoided. This is Sunil Kohl for AR News from Srinagar.
Employees State Insurance Corporation has informed that it has been providing treatment to migrant workers with valid medical benefit entitlements irrespective of their location. According to the corporation, the number of insured people in Maharashtra stands over 48 lakh, while the number of employers stand a little over 1.76 lakh.
Regional Director of ESIC Maharashtra Pranay Sinha has informed that migrants having valid medical benefit entitlement can avail treatment at any nearby ESIC hospital in case of emergency. Besides its 15 hospitals and 55 dispensaries across Maharashtra, the corporation has further tied up with 264 private hospitals to ensure proper care and treatment to all its members. Mr. Sinha said patients getting tested for coronavirus at any ICMR-approved lab are getting reimbursement. Meanwhile, Maharashtra Chief Minister Uddhav Thackeray has informed that 1 crore 47 lakh rupees have been refunded to patients who were charged above the state-approved prices. He said the Municipal Corporation of Greater Mumbai has so far addressed over 1,000 complaints of overcharging involving more than 37 hospitals. Nisha Rani, AIR News, Mumbai.
India has conveyed condolences to the government of Bhutan on the loss of lives of 4 brave Bhutanese soldiers who sacrificed themselves in saving those impacted by floods in Gelephu. In a tweet, External Affairs Ministry spokesperson Anurag Srivastava said, India stands in solidarity with Bhutan at this difficult moment. And now let's take a look at the weather forecast for tomorrow. The national capital Delhi will witness generally cloudy sky with light rain. It will have a minimum temperature of around 24 degrees Celsius and maximum of 35 degrees. Mumbai will witness generally cloudy sky with light rain. The minimum temperature will be 27 degrees Celsius and the maximum temperature will be around 33 degrees. Chennai will have generally cloudy sky with light rain tomorrow. The temperature will hover between 27 and 35 degrees Celsius. Kolkata will witness generally cloudy sky with a few spells of rain or thunder showers. The minimum temperature in the metropolis will be around 26 degrees Celsius, while the maximum will be 31 degrees. On to the north, in the Union Territory of Jammu and Kashmir, the minimum temperature will be 26 degrees Celsius in Jammu, while the maximum will be around 34 degrees Celsius. The city will have mainly clear sky, becoming partly cloudy towards afternoon or evening. In Srinagar, the minimum temperature will be around 16 degrees, while the maximum will be 30 degrees. The city will have mainly clear sky, becoming partly cloudy towards afternoon or evening. Leh Ladakh will have mainly clear sky, becoming partly cloudy towards afternoon or evening. The temperature will hover between 16 and 28 degrees Celsius. In Gilgit, the temperature will hover between 19 and 33 degrees Celsius. It will witness mainly clear sky, becoming partly cloudy towards afternoon or evening. In Muzaffarabad, there will be mainly clear sky, becoming partly cloudy towards afternoon or evening. The minimum temperature will be 20 degrees Celsius, while the maximum temperature will be around 32 degrees. Chandigarh will witness generally cloudy sky tomorrow. The minimum temperature in the city will be 24 degrees Celsius, while the maximum will be around 33 degrees. In Dehradun, the temperature will hover between 22 and 30 degrees Celsius. The city will observe partly cloudy sky with possibility of rain or thunderstorm or dust storm. In Hyderabad, the minimum temperature will be 22 degrees Celsius, while the maximum will be around 31 degrees. The city will observe generally cloudy sky with moderate rain. In Bengaluru, the minimum temperature will be 21 degrees Celsius and the maximum will be 31 degrees. The city will have a generally cloudy sky with moderate rain. Ahmedabad will witness generally cloudy sky with light rain. The minimum and maximum will be around 26 and 37 degrees. Bhopal will have partly cloudy sky with possibility of rain or thunderstorm or dust storm. The minimum temperature in the city will be 24 degrees Celsius, while the maximum will be around 33 degrees. Patna will observe generally cloudy sky with moderate rain. The minimum temperature in the city will be 26 degrees Celsius, while the maximum is expected to be around